Hello everyone, myself Deepal. Once again I'm back up with a new and interesting topic. My today's topic is Indigenous vaccines in Indian history. In this video, I will give you information about two indigenous vaccines. Those are Remdisiver vaccine and covishield vaccine. Also, I will give you some information about corona pandemic because all these conditions are just prevailed only and only due to cause of corona pandemic in 2019 year. Okay, so firstly I will clear you one thing that the main aim or the main purpose of my videos to be created are just to create awareness among everyone about new congenital and unknown diseases in their daily lives. This video doesn't consist of any other purpose. Okay, firstly we will talk about the corona pandemic. The first case of corona pandemic or a coronavirus was been found in Wuhan, China in 2019. Then from 2019 it spreaded all over the world. I think the first case of COVID-19 patient in India was being found in Rajasthan in the month of March 2020, and from March 2020 till the current situation it's created life-threatening movement in the person's life. You might have heard the news that due to leakage of oxygen in the COVID care centers, many people lost their lives in Mumbai, Jammu and Gujarat. And this is I'm talking about the current situation in India. Currently in India and many places in Maharashtra, people are suffering the scarcity of oxygen cylinders, and just because the scarcity of oxygen cylinders, many people are losing their lives due to less amount of oxygen supplied to their body. This condition is prevailed only due to pneumonia, and pneumonia is another symptom of COVID-19 virus. And the condition prevailed in Bid, Maharashtra, that there is no cremation ground empty to decompose the dead bodies of the dead coronavirus affected patients, and also in Gujarat the same condition prevailed as all in Bid. So two types of coronavirus are SARS coronavirus and MERS coronavirus. SARS coronavirus generally means severe acute respiratory syndrome, and MERS coronavirus generally means Middle East respiratory syndrome. And now current situation in India and all over the world, we are suffering the problem of SARS coronavirus. These both are generally the problems related to respiratory canal or respiratory problems. So, COVID-19 or coronavirus generally belongs to the family of Nidovirus. Now, Nidovirus is a family which affects the vertebral column of human spinal cord and animal spinal cord. Now, it's not necessary that COVID belongs to the family of Nidovirus, so it affects the spinal cord area. No, it's not the true. It affects our respiratory canals. Okay, now I will end the topic of corona pandemic. Now I will start the discussion about the indigenous vaccines in Indian history against COVID-19. Firstly, we will talk about Remdesivir vaccine. Now, Remdesivir is a vaccine which is manufactured by FDA company of US, and also it is manufactured by Gilead company of US. In the year 2013, it came into trial for the hepatitis C and potential use of Ebola. Now, what do you mean by hepatitis C or generally an hepatitis? Hepatitis generally means the liver inflammation or liver problems. In this, the bile created by the gallbladder is being blocked in some way. And now what's the main function of bile? Bile's main function is to digest carbohydrates and fats in a food. Now let's talk about the Ebola. Ebola is a new word you might have heard now. Ebola's first case was found in the year 1976 in the Democratic Republic of Congo. You might have heard the name of Congo. Congo name is specified for the name of the Congo River. Congo River is the deepest river in the world in West Africa. Now, Ebola disease is related to bleeding disorder, and also it leads to the organ failure, and a person can lead to death. And generally, Ebola spreads when a normal person is being affected by the affected person's fluid. During the period of 2013 and 2016 duration of time, it was being tested that Remdisivir was an unsuccessful vaccines from three of them against Ebola pandemic in the Democratic Republic of Congo. In the revival of year 2020, it was being experimented or it was being tested that Remdesivir vaccine turned a successful vaccine against SARS Covid-19 pandemic. Side effects of the Remdesivir vaccine are liver problems, negatively, low blood pressure, vomiting, sweating, muscle ache, etc. And Remdesivir vaccine is only a vaccine which is given to a particular person when a particular person is being affected by COVID-19 virus. So all the vaccines against COVID-19 are given in two stages, means two doses are being given to a particular person after the duration of 1 month. So here I conclude the topic of Remdesivir vaccine. So now I will start with covishield vaccine. So covishield vaccine is being researched in the Oxford AstraZeneca, but it is being manufactured in Serum Institute of Pune, which is located in Maharashtra, India. So Covishield vaccine doesn't consist of SARS-CoV-2 virus. It consists of adenovirus in itself. Now I will explain how the Covishield vaccine works on the human body. Okay, now I am going to explain you that how the Covishield vaccines work. Can you see the structure of virus here? Could you see the receptors around the nucleus coat-like structure? Yeah, this receptor's main function is to coat the virus or to protect the genetic material inside the virus. Now, this receptor's main function is to identify a particular type of virus. Generally, these receptors are made up of proteins and they are binded up with the SARS-CoV-2 virus. And inside the nucleus-like structures, genetic matter is known as Andeovirus. Now I will explain when the person is being vaccinated by the Covishield vaccine. Now how the Covishield vaccine affects this virus. You might have thinking that this coating of the virus is being done by the SARS-CoV-2 virus. So you will be affected by COVID-19, but it's not true. We are affected by COVID-19 when COVID-19 is alive and inside this Andeovirus is present. But instead of Andeovirus, when the genetic material will be COVID-19, we will be affected by coronavirus. When a particular virus genetically take place in our body, it gives to the rise of new virus such as coronavirus and many other viruses in our daily lives. Okay, could you see this Y-like structure around the proteins coated SARS-CoV-2 virus? So this Y-like structures are the antibodies or the antigens which is being raised up in our body after being vaccinated against COVID-19. As you know, there are two stages of being vaccinated against COVID-19. So after the second dose of being vaccinated against COVID-19, there are accumulation of antigens or antibodies in our human body so that it will create the 70.4% efficiency or immunity power to fight against SARS-CoV-2 virus. So after being vaccinated also, if you're affected by COVID-19, there is no worry because this accumulated antigens or antibodies can win up and fight up through the SARS-CoV-2 virus because these receptors around the nucleus-like structures or Andeovirus can identify the SARS-CoV-2 virus and let the antibodies fight through them. Efficiency of stronger vaccine against COVID-19 is 90%, but the efficiency of Covishield vaccine is just 70.4% as experimented in the labs. But in some countries, people experienced that after being vaccinated from the second dose of COVID-19, their efficiency will increase up to 90%. But in India, about 1,500 people experienced that only 70.4% immune power is strengthened from the covishield to fight against SARS-CoV-2 virus. So I just want to conclude today's topic. So it's my humble request you that you be the next person to be vaccinated against COVID-19. You capture up all your strength and confidence and leave up your fear and just being vaccinated. And only we can break this chain of corona pandemic. So thank you for watching my video and just share this video as much as possible because I just want to break this chain of corona pandemic. This is my just 1% of contribution to India to break this chain. Thank you. Bye.